Hello, everybody. Welcome back to Design and Thrive podcast. We have an amazing guest all the way from Seattle, Washington. His name is Ian Metz, and he's with JOYA Health. Hello, Ian.
Hey, Knock, thanks for having me.
Welcome, welcome. So let's get to it. To start us off light, what's one morning ritual that sets the tone for your workday?
Yeah, for me, I'm a father of a child under five. So for me, morning ritual means making sure I get some really good quality time with my son. The activity varies usually, but it's usually some kind of quality time. And then I, majority of the time, bike him to school. So that's become part of the ritual is we do a little morning rip, and he has a sweet bike seat that sits him in the front of me, which is so cool. So he basically gets to ride the big bike with me. So that's, I'd say my
Awesome.
ritual is dad life in the mornings. That's what gets me going.
Sweet. Perfect. Can you share the defining moment that inspired you to join the JOYA mission full time?
Yeah, so for me, it was actually twofold. Having built technical products for the last decade plus. I think one of the big draws for me was the problem space that Joy is tackling, which we'll get more into today over our chat. But that was a big driver, and then not only the problem space from a product development standpoint, but the mission of how Joya is looking to solve that problem, right? So how do we actually bring basically access and affordability to skin health and sort of the skin care area, so to speak. So I think the way in which Joya is doing this is particularly unique with this medical element that we'll get into, but also by being able to deliver a better aesthetic experience as well for our consumers. So kind of a mix there. And then let's be honest, when you join a small seed stage company, the folks that, our founder and CEO, Mike, he's particularly inspiring. And so being able to connect with him and finding a really good working relationship very quickly with him was also a huge inspiration for me to come join full time. You want to work for great people who are pursuing a great mission ultimately.
Perfect. So what's a fun or unexpected hobby you enjoy when you're off the clock?
Ooh, so I'm deeply obsessed with the outdoors and anything that gets my blood pumping. So if it's generally gonna get me down somewhere fast or from high up, I do it. So I'm huge, a big snowboarder, been doing it for 20 years. I ride quads, dirt bikes, snowmobiles, you name it. But if it goes fast and it's outside, then I probably do it. Also, of course, like the other stuff, hiking, backpacking, I stand up paddleboard, all that good stuff. Basically anything outside and anything with some adrenaline, I'm there.
Okay. So Joy is positioned as the first employer-backed skin health benefit. How would you describe your core value in one sentence?
Ooh, one sentence is tough, but I think, we have a novel vehicle through which we're able to, again, drive access to quality care and affordability of treatments and services tied to that care. And all of this is, of course, focused on skin health.
So your employer paid model offers $1,000 plus in benefits. So walk us through what a typical member journey would look like.
Yeah. So to your point, the general requirement is, we are a voluntary, generally voluntary employee benefit. So in other words, employers have to contract with Joya. And once they decide to bring Joya on board and offer it to their employees, they have many ways they can offer it. They can make it fully voluntary and employee paid. They can subsidize it partially for their employees, and then employees pay the difference. They can also fully subsidize it. So we have different ways that the employer can bring it and make it available to employees. But once it's been made available, then the employee must choose to sign up. And of course, in cases where they're covered, the employer will pay for it, but they still have the action of actually signing up and setting up a Joya account. So once they've done that and they've set up their account, we'll collect some information about the user, about our consumer, and that's generally going to be, historical kind of back looking information. So we call that our skin profile. So the intent with that is we learn a little bit more about your skin health history, because that helps inform for us on our platform, for example, which providers might be a best fit. It also helps us understand, where for your treatments and services that you'll receive using the Joya services, where we can best serve you. So again, it gives us that a bit of qualitative insight into your background so we can cater a better experience. So once we've collected that skin profile, then the final step is consumers then have to pick a provider to match with. Now, we have a vetted network of a ballpark about 2 to 250 providers, and that's growing every day with a backlog that is also growing every day, which we can certainly get into from a challenge perspective. But ultimately, that network of vetted providers is inclusive of dermatologists, followed by medical spas, followed by plastic surgeons. And I'd say the medical spa derm split skews a little bit more heavily towards medical spas in terms of our network composition, with a very small percentage being plastics and then derms filling the rest. So once the consumer then finds a provider that's a good fit, and usually that's some combination of how close are they to where I live, what services do they offer, what are my needs, my concerns that I want to address. And so the consumer actually then has the option to then match with a provider, and they can filter down and pick on whatever criteria is most relevant to them. And then once we've matched the consumer to a provider, that provider is then going to be the person they work with for the duration of their JOYA benefit, right? So in other words, they're going to be the one that the JOYA member goes to see to go get their services, to go get treatments, where they would do consultations and follow-ups. So this is how we've also been able to solve the marketplace dynamics of JOYA, right? For the consumer, it guarantees care through a consistent provider. And then on the provider side, by having guaranteed consumers, it essentially gives them guaranteed pipeline of patients to serve, which is in the best interest of both the consumer and the provider for those two reasons. So once that's done, though, once they're matched at that point, then they're able to use the benefits. You want to dive into a little bit more of the benefits, or do you want to come back to that?
Yeah, what kind of benefits do you offer?
Yeah. So once you've matched and you've, completed the onboarding process as a consumer, that unlocks a whole slew of things for you. So just to kind of run through the list, the first thing that we do, and I mentioned there's kind of this medical element, is we do a skin cancer screen. Now, most of the time that's free. A caveat here is if you see a dermatologist and you get your skin cancer screen and that dermatologist accepts your insurance, they may choose to bill your insurance. You may still have a copay, but I'd say the vast majority of our consumers are getting this skin cancer screen for free. So once they get that skin cancer screen completed, what that does is we've treated it as a gate. Now, this is important because when you look at the numbers, particularly with melanoma, right, skin cancer, it's fascinating. If you catch it early enough, you have a very, very high likelihood of being able to resolve it. For example, you do a biopsy, it comes back positive, you can cut the mole out, and if you catch it early enough, you're good to go. Problem's resolved, no issues, right? But if you catch melanoma too late, the mortality rate is very high, very, very high. So what our angle here is that we're basically playing a numbers game. And so by the more people we can administer through our network, skin cancer screens, the higher the likelihood of us catching melanoma early. And that's important because, again, if you catch it early, you have a higher likelihood of being able to resolve it with less to no long-term consequences. But also for the employers that we work with, this is a really important piece because when you think about employers, most employers are required to offer some kind of healthcare coverage. Well, if you have a melanoma or skin cancer that is caught too late and you actually have to go through chemo and full-on treatment for that cancer, then the total cost to the healthcare plan is in the hundreds of thousands of dollars versus in the thousands. So in other words, in summary, this helps consumers by running these skin cancer screens because we purely based on numbers, for every few hundred scans we do, we'll catch somebody early and then they can go get that addressed. For employers, it keeps their long-term healthcare costs lower by focusing on the prevention and early detection. And that's appealing to employers when they look at their benefits packages because it costs them money. And so employers want to save money while still giving great benefits to their employees. So this is a way where, they can pay for JOYA, catch this up front, and then avoid some of those long-term costs through this preventative measure, right? So kind of a win-win situation. But that's the medical piece of this. So once that piece is done, that then unlocks some of your additional benefits that are more aesthetic focused. So mainly, you get a quarterly allowance from your provider of $125 a quarter to go towards your treatment plans. So that covers everything from facials to fillers to, injections, to neurotoxins, to microneedling, dermabrasion, you name it. So really any of these minimally or non-invasive treatments that folks are already spending money on, right? These employees are already going and getting their Botox injections or what have you. So this helps offset that cost, right? And it's essentially a concession that the provider makes. There's no cost to participate in our network for the providers. The only thing we ask is that quarterly concession, allow a $125 discount on the total cost of services per quarter, right? So that's the big one, is you get the $125 per quarter. You also get a free medical grade sunscreen annually. You get a free facial or peel annually. You get discounts on medical grade products. Averages about 20% per provider, but we do allow some flexibility. So I think upper I've seen is about 30% off. I think the lowest is somewhere like 15%, but average about 20%. You then also get access to a 24/7 asynchronous teledermatology platform. Bunch of words to say. You get access to 24/7 dermatology. And our platform is with our partners called DocBrite. And they're the folks we work with to administer this. But we actually cover your first consultation, and it's totally free. And then for any subsequent consultations with this teledermatology offering, we offer an ongoing 20% off of additional consults. So this is great because you can literally take an image, answer a few questions, and within 24 hours, a licensed dermatologist will respond to you, be able to assess what's going on, provide you with a treatment plan, and then when applicable, even write you a prescription for any medical grade products required as part of that treatment plan. So in other words, you can go end to end from, hey, I got this weird rash, what do I do about it, to here's what the rash is, and by the way, here's how to treat it, and here's a medication if you need it. Right, all of that's contained with our Telederm offering. And then, of course, we offer free education, monthly webinars, so you get access to content. We have a couple of folks on our staff in advisory type functions and various roles that are licensed practicing providers. So we also get access to insight. They'll participate in our webinars regularly. So it's a whole slew of things, and we're constantly adding more value. I can't say more on this yet, but what I can at least tease is we are also exploring a new potential AI solution where we can assist some of this process with a more technology-based solution. But fortunately, I can't disclose who that's with or what that looks like yet, but I can say some exciting things are coming. So that's about it in a nutshell.
Exciting. Yeah, awesome. So with the total addressable market north of $30 billion and a 10% annual growth, what's Joya's growth playbook like for 2025 and the rest of 2026?
Yeah. So as I mentioned, we are seed stage. We are currently beginning the process of raising our Series A funding round. Now, the recapitalization that comes with this next funding round is really going to start to focus on scaling our offering. So a couple of key pillars where we're really investing is obviously the provider network. So we have this interesting dilemma, right? Which is, in order to facilitate this model we've built with JOYA, we need providers to be in our network and available in person. Well, with only a few hundred providers so far and growing, that does limit geographically where we can bring JOYA members on, right? So in other words, we really need to grow this provider network and then continue to expand our reach across many zip codes. And we are already across 15 different states. We are in 200 plus locations and zip codes, or excuse me, we have 200 plus locations across many zip codes. So again, always growing, but we need to accelerate that and we need to automate some of that. So some of this next year will be spent continuing to invest in that provider network. And then, as I mentioned, there's some exciting things in the pipeline, like this AI solution that we are starting to pilot soon, that will also provide opportunities to really beef up kind of the offering and increase the value, not just for our consumers, but also to our providers, hopefully, for joining our network. So more on that to come. So that's a big area of investment. The second area of investment is really, I would tie that centered around distribution. So we've been experimenting this year with a few different ways to increase our distribution. One of those is through our broker partners. So the benefits world is kind of interesting. You have a few key personas we serve at JOYA. So there's obviously the consumer, also known as the employee, right? This is the person who signs up for and uses the benefit. We then, of course, have the employer, who's the one that signs the contracts and chooses to offer the benefit of JOYA. Then we have obviously the provider, who's the doctor side, medical spas, derms, and plastic surgeons, and that's important for our provider network. We have this fourth persona that, at least for me, was new because I'm new to the benefits world. And that fourth persona is something called a broker. And brokers are really interesting because they essentially are like an umbrella. They sit across a bunch of employers. And these brokers for these employers are the ones who are actually helping build the benefits packages and then also administering them, facilitating support. They're kind of this conduit between employers and the various benefits that are out there, right? Because while we're the only ones offering a skin health benefit, there are many, many different voluntary benefits. Common ones people know are pet insurance, orthodontia. Those are all like add-ons to your typical medical, dental, and vision, right? Which are the sort of standard benefits. So this broker persona has been one way we've been able to start to tackle some of our distribution challenges. As one might guess, it's not super sustainable to go to every single employer and talk to them about this and sell them and go through that process. While we are still engaging in that way, we found we need additional ways to scale. And so brokers have been a really big key. So shout out to our broker partners. They've been phenomenal. We literally couldn't do this without them. So that's been one way, but we have a few other plays in the pipeline that could increase distribution moving forward. We've just dipped our toes in a few. For example, we launched recently in a couple of benefit marketplaces where an employer can sign up for these marketplaces, and that can be an avenue for how they administer benefits. I myself have done that at a previous employer where they say, hey, you get this login to this marketplace. You can choose 5 benefits that you want, totaling this amount of dollars. And then you can just pick and choose what's right for you. So we've experimented a little bit with that, but has not scaled yet. I think that's another area is like we really invest next year in growing that distribution and really scaling our reach, right? And then I think the last thing I would add is just really around product innovation, right? We want to continually grow the benefits package. We want to increase the value over time that we're providing to both consumers, but also providers, right? And so as we continue to do that, we have a number of various big bets, so to speak, that we're placing or in the process of placing that will definitely carry into next year. So from now through the end of the year, we're piloting a few of these bets. And then the ones that perform well based on our measures, next year we'll spend investing in scaling out, formally building out user interfaces, user experiences around, right? But for now, we're very much in let's place some bets, test them rigorously, and then the ones that take off, we scale. So I think that's the big 3 for next year, at least from my perspective.
Awesome. So in a crowded benefits ecosystem, how do you stand out?
Yeah, that's a good one. I think 2 things are really playing to our favor. One, it's the only one of its kind. So folks have literally never heard of this, right? And I think it's really interesting considering when you do look at all the benefits out there, gosh, seems like there's a benefit for everything nowadays, right? You can even get, there's even now, you have fertility specific benefits, you have mental health benefits, you have all of these different, very targeted benefits. But if you look at that lineup, skin health is glaringly absent. And now not everybody would obviously see that and register that. But when you actually stop to think about it, skin is our largest organ. It covers the most of our body. It's literally our shield to the things out there in the world, right? And so for being the biggest organ in our bodies, you would think it would get more investment, more attention, right? So I think that plays to our favor in that it's novel in part. It's unique. And frankly, as you mentioned before, this is a multi-billion-dollar industry when you think of these treatments, particularly minimally invasive aesthetic leaning treatments. And there's a lot of money being spent from these employees already. So we're not necessarily new in that, the concept of like skin health, but we're new in that we're trying to tackle the affordability and the accessibility of it. And so if you're already buying these treatments, why wouldn't you want a discount? Why wouldn't you want to be able to go to a trusted provider that's already been vetted for you, right? So we're essentially trying to piece together what has previously been a very disparate space and actually putting some real guardrails, kind of wrapping our arms around this to say, why don't we bring all these pieces together? Because it's been done already in other places, like you look at healthcare and all these other areas with benefits, these players have come in and kind of aggregated and brought everything together so it all works together. So we're sort of serving that role, right? Second thing I'll keep brief, but I think is worth shouting out here and why we're seeing a lot of success here is tied to that, which is it's very pragmatic. Hey, I already spend N number of dollars every year or month on my skin health, right? Whether that's, injections and fillers, or that's just, hey, I buy medical grade products. Everybody and their mother now is, using tretinoin or some of these like very common, things which are, require prescriptions still. But we have a really high conversion rate. So for most voluntary or elective benefits, you see somewhere in the range of like 2 to 4%. And then, so like pet insurance hovers about 2% enrollment, right? So if you have 100 employees, about 2 of them will probably sign up for pet insurance, right? We sit at ballpark about 10% conversion. So it's really high when you look at baselines of other voluntary benefits. which has been really good early signal and validation to us to say people actually like this. They want it. If 10% of your employees that you offer this to sign up right away for it, we're on to something, right? Now, obviously, we don't compare that to like medical insurance or something that's considered a critical function, right? Most of those are 100% or close to 100% participation. So that's not in our baselines. We're talking truly voluntary benefits. So I think that's the big kind of drivers for us right now at this time.
Okay. So, what's one emerging trend in skin health benefits you expect to see explode in 2025?
I don't know if it's necessarily going to explode in 2025, but I can comment, I think, on a huge overarching trend that we've really been seeing, and I think that's we are seeing a general age shift to younger demographics when it comes to skin health, right? So, in other words, I think right now on platform, I think our youngest member is 20 years old, and it's worth noting we do have a hard requirement, a legal requirement that you have to be 18 or older to join JOYA. So our youngest is 20. And then I believe the oldest member we have on the network was 75, 76, I believe, so mid 70s. So that just gives you a sense of just the existing sample, the range of ages and the demographics of people who care about their skin and who are taking an active role and an active stance in improving their skin health through their skincare routines, through the products they use, through even their eating habits and their hydration, whatever it might be. That range has really grown a lot, right? I mean, you talk to your average Gen Z human, and I guarantee they have a 20-step or close to it skincare routine, right? And you look at millennials, and most of us have, somewhere in that ballpark of like the 5 to 10 step routine, right? But you go back to Gen X, the boomer generation, it's like, how many people would be like, I don't even wash my face, right? Like the wisdom has changed so much. We've learned so much about our skin health, and there are just so many options and products out there. And frankly, there's also just the shift societally, at least in American culture, where, the focus on skin health, you want to look radiant and glowy, and sure, maybe like the terms and the looks change a little bit, for a while looking dewy and very fresh was the look, and now it's a lot like sharper lines. So these things change a little bit aesthetically, like aesthetic preference wise, but this overall trend of this growing focus on skincare and skin health, and then this shift to younger and younger ages or demographics has really continued to expand the total addressable market, right? Because now it's like I'm talking to 20-year-olds and I'm talking to 70-year-olds when it comes to what we do and what we're providing, right? So that's a huge range. I mean, how many other industries have that big of a target demographic in terms of age range? It's not a lot, right? There's usually sweet spots. We've got most of people's life now as a sweet spot. So that's a big one, I'd say.
Definitely. Okay. And you just integrated with Aesthetic Record. What
Yeah.
opportunities does that open for members and providers?
Yeah, so shout out to the Aesthetic Record team. They were wonderful to partner with. Really, that was, I would say to a T what you'd want with a strong partner, particularly for anything requiring technical integration. But the key value prop is twofold. So they were our first EMR system that we've integrated with, and EMR stands for electronic medical records. So if most healthcare providers, ranging from your primary care to your specialists to you name it, are using some flavor of an EMR. It's how they basically store and transmit electronic records, right, with both you and other doctors within network, et cetera. So being that it was our first EMR, it was important that we found a really strategic partner who was not only willing to just do an integration with us, but was also really willing to work with us and kind of partner on growing and expanding our reach, right? So I think the value prop was two, maybe threefold, you could argue. For providers, what this opened up is now when a provider who is on aesthetic record and on the JOYA network, whenever they complete a appointment with a patient, they can just follow their existing workflows in their practice for post-visit data, right? Anytime you do a visit, your provider has to fill out like, what did they come in for? What did I treat them with? What was administered, right? All of that's just standard practice with any medical provider or similar. And so the EMR is just the place they store that. So by doing this, they can follow their existing workflows. That's a huge win because for those providers that are on JOYA but not using aesthetic record, they do still have to use the JOYA system, our actual interface for our provider portal, to input the data for the visit. Now, future state, my vision for this is that we have no more manual data entry on the JOYA side for the provider. Future state, I would love to be integrated with every EMR out there. So all I have to do is just set up the provider, their listing on JOYA, and then all the rest of the systems are handled through the integration. That's a future state. So as I, over the next, coming months to years, continue to chip away at that, we'll bring on additional EMRs, right? But that's kind of the value prop to the provider is more efficient and existing processes and workflows exist and really no change there. The key value prop to consumers is it has opened up a easier path to online booking. Because now if the provider is using aesthetic record and they're on JOYA, we just surface the direct booking link. So now the consumer doesn't have any kind of back and forth to do scheduling. They can literally just go into the portal. They can then see a real-time list from the aesthetic record system of that provider's ability and book right there. For those that are not, there's still a step where they have to get in touch through our portal with the provider's office to schedule. So that eventually, future state, I would like to be able to replace that. So everything is fully virtual, all online booking, but that requires the integration. So I think that's the key value props there. And then on the business side, aesthetic record has been an amazing partner. And we see a lot of shared opportunity where obviously there's a win-win-win where if a provider is on aesthetic record and on JOYA, they're getting an increase in patients and guarantee revenue stream from JOYA. And then they have lower overhead and operational efficiency through the aesthetic record side. So they're also helping us to really drum up and grow that provider network quickly. They've been a key partner in helping us build up that network because if they're already on aesthetic record, it's a pretty easy jump to come over to JOYA. So I think that's the big ones in a nutshell. And I'd expect similar value props for these other EMRs as we go over time.
Okay, Ian. So what's the most powerful outcome you've seen, whether a member with early cancer detection or self-esteem transformed?
Yeah, so I will say I'm getting some good qualitative feedback on this. One problem I'm trying to find better solutions for is how do I measure some of that quantitatively? It's a bit of a tough challenge, right? What I would like to get future state is to a point where I can have actual quantitative, measurable outcomes, right? So, for example, is there a future world where I could actually attribute, hey, because we caught so and so's potential melanoma early, it saved this many dollars versus if we would have caught it later. I haven't gotten to that point. That's not something I've fully solved with a team yet, but that's a future state we want to get to. So in the interim, the best I've got for that is really qualitative. I'll share a specific anecdote. We actually, we run research on a regular cadence with providers, with consumers. And so in one of our latest rounds of research, we spoke to a consumer, a JOYA member, and this particular person had a really great story where they actually came in and they had jaw pain. And they came in, to use their JOYA benefits, and they're kind of going through, here's the things I want to work on. I want to get some of my wrinkles treated. And, while I'm here though, I have this jaw pain, and I'm not really sure what's up with that. Well, actually, in that conversation and at that particular member's visit, the provider they saw was like, hey, funny enough, that could be TMJ. And we actually treat people with Botox injections in their jaw to help alleviate pain related to TMJ. So that one interaction with the JOYA provider, while that provider wasn't able to diagnose, they were at least able to give that patient some insight that then led the patient to go, I just thought it was me. And you know what that patient actually went and did, that consumer? They went ahead and they went and saw their actual practitioner, their doctor, their MD, and now they're actually pursuing a TMJ diagnosis. Because when you have a TMJ diagnosis, there are some insurance carriers who will also cover then the cost of Botox treatment on your jaw because it's addressing a medical need. So that whole interaction set this person down this path to go, one, it's not me. I'm not crazy here, right? I'm actually having pain and there is actually something going on and there's a way potentially to address it, to them going and getting a diagnosis and are now continuing to get their aesthetic treatments, but now have a path for a medical treatment for a necessary issue that they're facing, right? So I love that one because I thought it was this interesting intersection of how we kind of help facilitate that set of next steps with the medical side while also being able to meet their needs on their aesthetic concerns, right? So that's probably one of my favorites that have come through recently.
Okay. So lastly, to close us off, How can listeners find more about Joya?
Yeah, absolutely. So right now, because we are still dependent on your employer offering or choosing to offer Joya first, we don't yet have a path where you can just sign up directly. Although maybe more to come as we continue to experiment with that, with a future of maybe a direct to consumer model. We'll see. But that being said, you would just need to reach out to us on joyahealth.com. That's JOYAHEALTH. So joyahealth.com. And depending on what your role is at your company, if you're just an employee, if you are HR or somebody who manages benefits, we have a multiple areas in our website where we have lead forms that you can submit information. You can also reach out to our support team. All of that information is listed at the bottom of the site. But all we need is just who should we talk to and what's the names, and then we can take it from there.
Perfect. So that brings a close to Design to Thrive. And that was Ian from Joya Health or Joya. Thank you, Ian.
Thanks for having me. It's a great time and appreciate it. And looking forward to your listeners hearing more about us and hopefully hearing from them.